A major warning from health officials tonight. They say with school back in session and the Delta variant still spreading, more kids are getting infected with COVID.
And that is leading more kids to being sent to the hospital with COVID. WCNC Charlotte's Chloe Leshner is live at Novant Health in Elizabeth. Chloe, the good news is that for the most part, kids don't get severe cases.
Yeah, Tanya, but right now 25% of COVID cases nationwide are in children. And so for some kids, it just affects their school schedules, but for others, it can be more dangerous. And we know that kids can spread it to vulnerable adults, and our hospitals are already strained. Pediatricians are seeing an unseasonable trend. The weather's still warm, but more kids are needing doctor's appointments, ER visits, or hospital admissions.
We're seeing co-infections, so we're seeing COVID, we're seeing other infections such as RSV that are really prominent right now.
In the first week of September in North Carolina, more than 11,000 children tested positive for COVID. That's more than in all of June and July. It's leading to a rise in the number of kids needing hospital beds, but doctors say it's still not as deadly in younger people.
I think there's a lot of reasons to have some concern over this. I think obviously kids, for one, are always around other people, whether it's adults or kids.
The trend also happening in Mecklenburg County in the last 2 weeks.
So a third of all tests that have tested positive have been among preschool, school age, and college age kids.
The increase in cases can be attributed to in-person classes and more activity in the community. Plus, people 12 and younger can't be vaccinated yet. Of the kids hospitalized, doctors say 95% are not vaccinated.
I would expect those numbers are only going to increase, and I think there has to be, a social awareness that if this continues, it's going to be difficult to care for all of these patients.
A vaccine for younger school-age kids could be coming soon, though. The CEO of Pfizer said that the clinical trial data for kids 5 to 11 could be submitted to the FDA by the end of the month. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
All right, we'll be watching it closely. Chloe, thank you.